what strategies can developers use to address biological barriers such as endosomal escape and tissue-specific targeting? Steve, let's start with you on this one.
You need a targeting domain, whether you're delivering a conjugate oligonucleotide or a lipid nanoparticle or a synthetic nanoparticle. You need a targeting domain or a way to get your particular cargo to the tissue of interest. So this avoids both off targets in normal undiseased tissues, and of course it reduces the cost of goods, patient exposure to the drug platform. The second thing we need is you need an endosomal escape device. So for RNA, siRNA, and ASO conjugates, we do not have an endosomal escape agent modality at all. There's nothing. That's like all still stuck at basic discovery. Everything you've ever heard about endosomal escape is false. It'll never work in the clinic. HA2 peptide was discovered 30 years ago. There's never been a clinical trial. It's way too toxic, causes endosomal rupture. For the lipid nanoparticles, the ionizable lipid is the endosomal escape device, and that does work 10 times better than how conjugates get out. So it points us in the right direction. We just need to figure out a way to take that mechanism of action and apply it to a small conjugate, which is 25,000 times smaller.
Thank you, Steve. That's a great answer. Kehinde, do you have anything to add there?
Sure, I totally agree with what Steve said. It's really crucial to have endosomal escape mechanisms that are non-toxic in order to release sufficient amounts of the oligonucleotides into the cytosol where they can exert their effects. I guess the other key challenge relates to the actual design approach and whether it's conjugation versus, say, bundling into nanoparticles. If you think about the manufacture of these things, sometimes there are challenges when it comes to conjugation that maybe can be overcome more readily if you bundle the oligonucleotide into nanoparticles. In my lab, we're working on peptide nanoparticles as an approach. It still needs a lot of optimization, but some studies have used that method previously, and we're trying to build on that. But to be sure, it will be important to have a clear demonstration of efficacy at clinically relevant levels of treatment.
Thank you for watching this webinar clip from Nucleic Acid Insights. Follow the link in the description to the full webinar if you would like to see more. If you would like to see more like this, subscribe to our channel, and for more content covering the latest news, trends, issues, and breakthroughs, check out our journal webpage using the link in the description.